During the past few weeks, we've seen an increase, unfortunately, in cases. We saw, first of all, a plateau. Now what we're seeing is an increase, and we're also seeing an increase in positivity. I'd like Dr. Vanderhoff to tell us now exactly what he is seeing out there, what the epidemiologists are seeing, and what they're seeing specifically in regard to variants, and also what is going on in Michigan and other states. Doctor?
Thank you very much, Governor. Well, as you noted, we are in fact seeing increased COVID activity here in Ohio, and that mirrors much of what we're seeing in the rest of the nation. After a long and dramatic decline, cases leveled off last week and are rising this week. Nationally, this picture has been more dramatic in two hotspots, Michigan and the New York City, New Jersey area. In fact, according to the CDC, Michigan's upturn is more than 3.5 times what we're seeing in Ohio at this point, and appears to be driven substantially by variants, especially the B117 or so-called UK variant. Here in Ohio, variant activity continues to rise, especially B117 and the two California variants, B1427 and 1429. Together, these three account for more than 80% of our 620 genomic detections. And just to give you an idea of how quickly variants are spreading, our variant counts have jumped from 92 on March 12th to 173 March 19th, and of course, now today, 620. Cases, as I noted, are also up in Ohio for the first week in a long time. Our 7-day average of new cases per day was a little more than 1,800 this week, compared with 1,500 plus last week. And yesterday, we saw almost 2,500 new cases. Now, not surprisingly, this has been accompanied by a rise in our concurrent hospitalizations, up from 851 a week ago to 978 yesterday. And our 7-day rate of positive test results is also up to about 4% from about 3% in mid-March. And while all parts of the state appear to be impacted by rising cases and more variants, many of our highest case counts and almost half of our variant detections are in our northern Zone 1 counties. So while COVID-19 is certainly not limited to any particular part of the state, we are seeing more activity, including more variant activity, on our northern border with Michigan. So Ohio remains in a race against a virus that is now more contagious and is right back on our heels. But we can win this race as long as we don't falter, as long as we press on with consistent masking and vaccination, especially in light of this week's important and encouraging research out of the CDC, confirming that the vaccines remain powerful protection against COVID-19, even in the face of the variants. Governor?
Doctor, thank you very much for that report. And Zone 1, for everyone, really runs from Toledo all the way to the Mahoning Valley, runs clear across from Bryan all the way across our whole northern tier. That's what we consider to be Zone 1.